Good day, dear students. I am Chmedronov Sergei Nikolaevich, the head of Human Anatomy Department in Samara State Medical University, and today we will talk about splanchnology, about internal organs, and in details we will talk about digestive system. So, splanchnology is anatomy section that includes organ systems, digestive system, respiratory system, urinary system, and sexual system. And all these organs are localized in thoracic cavity and abdominal cavity. So all internal organs are called in Latin viscera and in Greek language splanchna. And you may see this term splanchnology, which mean internal organs of all these systems. So next, let's talk about main anatomy of two types of internal organs. And you may see first type, this is tubular organs. You may see, for example, the histological examination of esophagus, of stomach and intestine. And you may see three main layers of the wall of these tubular organs. Internal layer is mucous layer or mucous membrane, which turn to lumen of organ. Second, middle part is muscular membrane or muscular layer, and also you can see in esophagus, in stomach, and also in intestine. And external layer is adventitia. For example, you may see this layer in esophagus, or serous membrane, or peritoneum, and you may see this layer on stomach and also on intestine. So next type of internal organ is parenchymal organ or parenchymal organs. And for example, you may see on this left histologic examination pancreas, and on this right histologic examination is liver. And so you can see two parts of parenchymal organs on this examination. First, cells form parenchyma. This is functional component of organ, and these cells form the functional part of organ. And next type and next part of parenchymal organ is stroma. These cells of connective tissue form the soft skeleton of organ, and they divide these cells and form units, structural functional units of organ. For example, you may see liver lobule as unit of liver. Next, let's talk about terminology. And first I want to tell about some terms in splanchnology. This first term is holotopia, which means the ratio of organs to areas of the body. You may see the ratio of liver to anterior wall, or for example stomach or spleen to anterior wall, anterior abdominal wall. Next term is skeletotopy, and this term means the relationship of the organ to parts of skeleton. And you may see the relation for chest and breast of liver. Next, you may see syntopia. This term means the relation of an organ to other organs. And for example, you may see the pancreas and its relationship to duodenum, to spleen, to gallbladder, choledochal ducts, and also to greatest vessels in our organism, vein, cava vein, and aorta, and also portal vein too. Next, let's talk about terms of abnormalities of internal organs. So you may see two terms which mean the absence of organ. First term is agenesis. This is defect of development associated with the absence of its formation. And as a result, as I told you, the absence of organ. So aplasia is second term, which means the defect of development of embryonic rudiment, and also as a result the absence of this organ. And for example, you may see the absence of left kidney in this body. Next, you may see next term hypoplasia, insufficient organ development due to delay at any stage of embryogenesis. And you may see, for example, this X-ray examination of kidneys, and right kidney is normal and left kidney is hypoplastic. Next, you can see hyperplasia, excessive organ development. And for example, you may see the excessive development of thyroid gland. Next, doubling of organ or duplication, the formation of additional organs due to multiple embryonic sites of formation. And for example, you may see in this X-ray examination with construct substance double right kidney in this body and normal left kidney on opposite side. Next, you may see the fusion of paired organs. And for example, you may see the fusion of two kidneys with low pulse of kidneys. Next, you may see atresia. This term means obstruction of the lumen of hollow organ. For example, you may see the obstruction of anus or hindgut. Next, diverticulums. These mean the abnormal outgrowths of hollow organs. For example, you may see Meckel diverticule here in laparoscopic operation. Also, you may see two abnormalities of topography of organ. First is heterotopy, the formation of organ in unusual place, and dystopia, the displacement of organ to unusual place in the embryonic period. And for example, you may see heterotopy of heart above the chest, under skin in child. Next term is inversion. the inverse position of the body relative to its own axis. And for example, you may see the left-sided liver. You know that in normal position, liver is situated in right half of body cavity. So next, in details, we talk about digestive system. And we talk some words about development. The development of digestive system forms from intestinal tube, and you may see this intestinal tube here, and it development from endoderm. The formation of tubes in prenatal period reflects the phylogenesis. During phylogenesis, the primary alimentary canal appears first as a tube stretching through the entire body of the animal, from the cephalic to the caudal end, and has an entry. Ultimately, from the cephalic end of this canal form the respiratory organs, whereas its caudal part communicates with the orogenital organs, as a result of which the cloaca forms in it. This is common opening for the organs of digestion, excretion, and reproduction. The urogenital organs of higher mammals are set apart from the other organs and occur their own orifice. As a result, the organs of vegetative life in higher vertebrates and humans are represented by three tubes communicating with the external environment by means of opening: the alimentary canal, which passes through the entire body and has two openings, the respiratory tube, and we will talk about the respiratory system and development on one of the next lectures, and urogenital tube. So the organs derived from the primary alimentary canal that stretch along the entire length of the body and possesses an entry and an exit are lodged in the thoracic and abdominal body cavities. The organs that developed from the respiratory tube are lodged on the thoracic cavity. So, digestive system is a complex of organs whose function consists in mechanical and chemical treatment of the food, absorption of the thread nutrients, and excretion of undigested remnants of the food. The structure of the digestive canal is determined in the different animals and in man in the process of evolution by the shape-forming effect of the environment, nutrition. So human alimentary canal subdivided into the following parts: cavity of mouth, pharynx, esophagus, stomach, small and large intestine. The upper three parts located in the head, neck, chest maintain in relatively straight direction. In the pharynx, the alimentary canal intersects with the respiratory tract. After the esophagus passes through the diaphragm, the digestive tube dilates and thus forms the stomach. The next in order after the stomach, the small intestine, is in turn composed in the duodenum, jejunum, and ileum, and large intestine consists of the cecum with the veriform process, you may see it here, the ascending, transverse, descending, and sigmoid colon, and finally the rectum. So, enterodermal primary alimentary canal is subdivided into three parts: anterior or foregut, from which develop the posterior part of the mouth, pharynx, esophagus, stomach, and the initial part of duodenum. You may see this part of foregut here. Next, middle part or midgut, communicating with yolk sac and developing into small intestine, and posterior or hindgut, from which the large intestine develops. So let's in detail we talk about derivatives. You may see this part is foregut, and on this picture you may see the development of stomach, duodenum, pancreas, and liver. You may see the parts of development of intestine. You may see this part is foregut, and you may see this part is midgut, and colon or large intestine is formed from hindgut. So first I want to tell that digestive system has some features in development. And you may see this classification of Tashkovsky about following types of abnormalities. You may see disorder of first period of rotation, umbilical hernia with the intestines here. Also, you may see disorders of second period of rotation of gut, failed bowel rotation, congenital inversion of the middle intestine, and duodenal obstruction caused by external pressure, non-turned cecum, and course extending from cecum. You may see this cord extending from cecum and failed bowel rotation. Next, you can see disorders of the second period of rotation, Leda syndrome, recurrent intestinal obstruction due to inversion of the middle intestine around the superior mesenteric artery, and high fixation of the cecum. Excessive fixation of duodenum, internal hernia, and turn to opposite direction. You may see that SN colon is situated on the central part of abdominal cavity and not in right as abnormal. Also, you can see leather syndrome here, micro microintestinal syndrome. Also, you can see disorders of the first period of rotation. For example, high location of cecum, mobile cecum, and location of the firmiform appendix behind the cecum. And you may see the high position of vermiform appendix near gallbladder. It's abnormal, and this abnormality develops from disorder of third period. So after this, I want to tell about common anatomy of digestive system. So first, let's we talk about oral cavity. You may see the operation after trauma of cheek and the wall, lateral wall of oral cavity. Also, you may see this operation from opposite side. So, oral cavity is divided in two parts: the vestibule of mouth and the cavity of the mouth proper. You may see on this picture vestibule and proper oral cavity. Vestibule of the mouth is the space bounded by the lips and cheeks, externally by the teeth and gingiva internally. By means of the opening of the mouth, the oral fissure rima oris. You may see number 4. The vestibule opens into the external environment. Lips or labia are fibers of the orbicular muscle of the mouth, covered on the outside by the skin and lined inside with mucous membrane. You may see also frenulum of superior and inferior lips. Cavitas oris propria extends from the teeth anteriorly and laterally to the entry into the pharynx posteriorly. The oral cavity is bounded superiorly by the hard palate and the anterior part of the soft palate. The floor is formed by the diaphragm of the mouth, diaphragma oris in Latin, the paired mylohyoid muscles, and is occupied by the tongue. You may see tongue here. When the mouth is closed, the tongue comes in contact with the palate so that the oral cavity becomes narrow slit-like space between them. The mucous membrane extending to the inferior surface of the tip of the tongue forms the midline, the frenulum. Next, let's talk about palate. The palate consists of two parts. Anterior 2/3 have bony foundation or palatum ossum, and you know this part of palate under your knowledge about skull, and posterior third is soft palate. This is muscular structure with a fibrous foundation. During quiet breathing through the nose, is it hangs obliquely downward and separates the oral cavity from the pharynx. So you may see the posterior part of palate, which called soft palate. So this palate contains some muscles. So it is duplication of the mucous membrane in which muscles are lodged together with fibrous plate, the palatine aponeurosis. So interior margin is attached to the posterior part of bony palate or hard palate, while the posterior part of the soft palate, called velum palatinum, extends freely downward and to the back and has on the midline a tongue-like projection uvula. You may see number 21. Laterally, the soft palate is continuous with folds or arches. The anterior palatoglossal arch and posterior palatopharyngeal arch. So a depression forms between the anterior and posterior arch. You may see it here, which lodge the palatine tonsil. Each palatine tonsil is an oval-shaped mass of lymphoid tissue. The tonsil occupies the greater inferior part of triangular depression between arches. Soft palate is composed of the following muscles: palatopharyngeal muscle, palatoglossus muscle, musculus levator veli palatini, musculus tensor veli palatini, and musculus uvula. Next, let's talk about salivary glands. You may see three big salivary glands: parotid gland, submandibular gland, and sublingual gland. So the ducts of three pairs of large salivary glands open into oral cavity. Beside this, there are numerous small glands in the mucous membrane of the mouth, which according to their location and are called as follows: the labial, baxal, palatine, and lingual glands. According to the character of the secretion, the glands may be serous, mucous, or mixed. So the three pairs large salivary glands attain considerable size and are located beyond the mucous membrane and retain connection with the oral cavity by their ducts. These glands are as follows: parotid gland, you may see it in number 7, is the largest of the salivary glands and is serous gland. It's situated on the lateral side of the face, in front of and little below the ear, and penetrates into retromandibular fossa. On the surface, the tissue of the gland extends upward almost to the zygomatic arch and downward to the mandible angle. The gland has lobular structure and consists of several lobes. The duct of the gland ductus parotidus, passes on the surface of the masseter muscle, curves around its anterior border, and after passing through the fatty tissue of cheek, pierces the buccinator muscle. It then enters the oral cavity under the mucous membrane and opens into vestibule of the mouth by a small opening opposite the second upper molar. Submandibular gland is of mixed character, compound alveolar tubular in structure, and the second largest after parotid. The submandibular gland is situated in submandibular fossa, emerges from under the border of the mandible, and is covered here by the skin, the platysma muscle, and the fascia of the neck. The fascia invests the gland and forms a muscle forms a muscle capsule, not only for muscles and also for gland. It's called submandibular sac. The submandibular duct passes over the mylohaloid muscle on the floor of oral cavity and opens on caruncula sublingualis. The sublingual gland, you may see it in number 5, is mucous type and alveolar tubular in structure. It's situated over mylohaloid muscle on the floor of the oral cavity and covered only by the mucous membrane, forms the sublingual fold. You may see this fold here. The ducts of some lobus, 18 to 20 in number, open independently into the oral cavity along the sublingual fold. They are called the smaller sublingual ducts. The principal duct of the sublingual gland passes next to the duct of submandibular gland and opens by means of a single opening common to both ducts, or by its own opening alongside the opening of the submandibular gland. Next, let's talk about teeth. Teeth or dentes are ossified papilla of the mucous membrane concerned with the mechanical treatment of food. So, teeth has two generations: deciduous teeth or dentes decidui and permanent teeth. Decidual teeth are situated in child, and permanent teeth are situated since 6-7 years old in children and also in adult body. You can see 3 main parts of teeth: crown, neck, and root. So crown is covered with enamelum, and neck and root are covered with cementum. So you may see the internal part of tooth. This is dentinum. Also, you can see the cavity of teeth. the cavity of tooth, which called uh, cavity and lodged with pulpa. You may see the blood vessels and connective tissue inside the tooth. So, teeth divided in 4 parts. First part are incisors. Next, second, canines, premolars, and molars. Also, you may see the abnormalities of teeth. For example, you may see heterotopy of canine teeth, and you may see the growing of these teeth from palate, also palate, also tarsia, turning of teeth, and also transposition. When the incisors are situated after canines, it's abnormally. And also you may see on this picture tarsia, turning over the axis, and transposition. You may see that canine on this picture is situated after premolar. Also, you can see the abnormality of size of teeth. If the teeth are very little, this abnormality causes microdontia. For example, you may see on this picture. And opposite abnormality with big size of teeth, it's called macrodontia. For example, you may see the macrodontia of first incisors or maxillary incisors on this picture. So you may see the occlusion of teeth which cause bite. You may see the normal bite here on this picture. And also you can see vestibular surface of teeth which form the posterior and medial wall of vestibulum of mouth. And also you can see abnormal bites, open bites, and curvature bites. Abnormal bites. So next, let's talk about tongue. You may see tongue here of this picture. In Latin language, this term is lingua. In Greek language, this is gloss. So this is muscular organ which covered with mucous surface, mucous tunic with papules, and the gloss is organ of gustation, as you know, because it has the gustation papules on the dorsal surface. Also, at the radix part of tongue, this is tonsil of lingua, of lingual tonsil, with lymphoid tissue here. And so the tongue has several parts, the apex, apical part, dorsal part, lateral part, and root. So the muscles of tongue divided in two parts. Skeletal part, the muscles arising from derivatives of first visceral arch, such are genioglossus muscle. You may see this muscle here. This is the largest of all tongue muscles and achieves highest development only in man due to the appearance of articulate speech. Next is hyoglossus muscle. It arises from hyoid bone. And so the muscles arising are the derivatives of the second visceral arch. Styloglossus muscle from styloid process. Superior longitudinal muscle, this is muscle of second group or proprial tongue muscles, and inferior longitudinal muscle. Superior longitudinal muscle arise on the lesser horns of the hyoid bone and on the epiglottis and stretch under the mucosa to the dorsum of the tongue on either side of septum linguae. The inferior longitudinal muscle arises from the lesser horns of the hyoid bone and stretch on the inferior surface of the tongue between genioglossus and hyoglossus muscle to the tip of the tongue. Third group muscles arising on the derivatives of the third visceral arch. Hyoglossus muscle arise from greater horn at the innermost part of the body of the hyoid bone. So you may see hyoid bone and hyoglossus muscle. So next, let's talk about pharynx. So, as I told you, in proprial oral cavity, it formed the breakdown of food with teeth and tongue, and next it's followed to pharynx from oral cavity, and pharynx divides in three parts. First part is nasopharynx, but this part is part of respiratory tract. Next you may see oral pharynx, and this part is both for digestive system and also for respiratory system, and the third part is a laryngeal part of pharynx or inferior part of pharynx, and this is a part of digestive system. So you may see that nasopharynx has um, phonics with the pharyngeal palatine, or pharyngeal, sorry, tonsil here. This is impaired tonsil, and also you can see the opening of eustachian tubes here, or auditive tubes. It's very important because the air goes from nasal cavity through these tubes to tympanic cavity. And as I told you, the nasopharyngeal part of pharynx is the part of respiratory system. So you may see the next middle part of pharynx. This is crossing part of digestive and respiratory system. And you may see that it has border between oral cavity with palatoglossal and palatopharyngeal arches and inferior part of velum palatine. So when we swallow the food, it goes, it passes to pharynx, to oral part of pharynx, and next it goes to laryngeal part of pharynx, and after this it goes to esophagus. So the wall of pharynx has lateral and posterior parts, and it has no anterior part, because on anterior part it has openings to nasal cavity with the coronus, as you know, and to oral cavity with the border of posterior part of proper oral cavity with velum palatine and palatoglossal and palatopharyngeal arches here. So it covered with the mucous tissue, mucous tunic here, with lymphoid nodes. Also it has muscular layer with constrictors. There are 3 constrictors here. Which form the lateral and posterior wall. You may see superior constrictor, middle constrictor, and inferior constrictor. So superior constrictor is arising to sphenoid bone, so middle constrictor is arising to hyoid bone, and inferior constrictor is arising to thyroid cartilage. Also it has, the pharynx has dilatator which enlarge the pharynx. This muscle is arising from styloid process and inserted in the pharyngeal wall and also to superior edge of thyroid cartilage. So the constrictors form the function of swallowing or deglutition, and the food goes to esophagus. You may see esophagus. This is hollow tube connecting pharynx with stomach. And esophagus has three parts: cervical part, thoracic part, and abdominal part. So, esophagus has number of constrictions, and you must know that all the constrictions of esophagus divide in two groups. First group is anatomic constrictors, which are observed also in a live person and also in calves. And second group is physiologic constrictors, which has only in a live person. So you may see first constrictor is pharyngeal constrictor, when the pharynx passes to initial part of the esophagus, behind the larynx, behind the cricoid cartilage of larynx. Next, middle anatomic constrictor is bronchial constrictor, behind the left principal bronchus. And third anatomic constrictor is diaphragm constrictor, when esophagus from thoracic part passes to abdominal part. And also you must know two physiological constrictors which are observed only in a live person. This is aortic constrictor, and also you may see the heart cardiac constrictor, about pulsation of heart. Also, you must know that in surgical classification there are 9 segments in esophagus, and you may see tracheal segment behind trachea. Next, aortic segment behind the aortical arch. Intra-aorta bronchial segment, number 3, between the arch of aorta and principal bronchus. Fourth is bronchial segment behind the left principal bronchus. Fifth is subbronchial segment below the left principal bronchus. Sixth, this is retrocardial segment behind the heart. Seventh is supraphrenic above the diaphragm. Eighth, this is intradiaphragmatic part or segment in hiatus diaphragmaticus. And ninth, this is subphrenic or abdominal. This is abdominal part of esophagus. So you may see the endoscopic investigation of esophagus, and also you may see the constrictor or sphincter between esophagus and stomach. On this picture you can see the abnormalities of esophagus. You may see the atresia of esophagus, and you may see the proximal end and initial beginning of parts of esophagus here. You may see on this X-ray investigation this stricture of esophagus. Also on this picture you may see the connection between atresia esophagus and trachea. This called stoma, tracheoesophageal stoma. And also you can see the stoma between the distal part of esophagus and trachea. On this picture you may see two stomas between proximal esophagus and between distal esophagus with the trachea. And also you can see on the last picture the absence of atresia, but you may see this stoma, the connection between trachea. On this picture you may see the diaphragm hernia, and also you may see expulsion of esophagus. Next, abdominal cavity and organs of abdominal cavity. You may see stomach, and one part of operation in stomach. Stomach is a sac-like expansion of the digestive tract. After passing through the esophagus, food accumulates in the stomach and undergoes here the first stage of digestion, during which the hard components are converted to a liquid or pasty mixture. It has anterior wall, posterior wall, fundus, carotids, curvatura ventriculi minor or lesser curvature, and curvatura ventriculi major or greater curvature. Also it has gastrical notch and cardiac notch or heart notch. So it has three coats or tunics: mucous coat, muscular coat, and peritoneal coat. You may see this histologic examination here. You may see that mucous membrane is situated here, and it forms the folds in stomach, and it produces the enzymes such pepsinum, and also it produces the hydrochloric acid for digestive function. Next, you may see muscular layer, and external layer, which call peritoneum or serous membrane. So the stomach has good developing circular muscle layer in the border between duodenum. You may see this part which calls a pyloric sphincter, and it regulates the passage from stomach to duodenum. So you may see duodenum. This is initial part of intestine, of small intestine, and it has 4 parts: superior part, descent part, horizontal part, and ascent part. And you may see that duodenum has the same layers such as esophagus or stomach. It has mucous layer, muscular layer, and also peritoneal layer. But also you can see that it has openings of pancreas and liver here, and you may see vatary papille here with openings of halitohol and pancreatic ducts. So the enzymes from pancreas passes to duodenum, and bile passes to duodenum from liver via the halitohus ducts. Next part of small intestine is jejunum. You may see jejunum, and it passes to ileum. There is no border between these parts, and one part passes to another, and they also have mucous layer with lymphoid nodes, submucous layer, muscular layer, and also these 2 parts, jejunum and ileum, cover with the peritoneum. So in jejunum and ileum, resorption of food, of meal is formed, and this is the main function, the function of resorption into these parts of small intestine. You may see the abnormalities of small intestine, hypoplasia, you may see on this picture, and also atresia, the obstruction of lumen of small intestine. And next you may see the Meckel's diverticulum or ileostoma. You may see the connection canal between ileum part of small intestine and narwhal. This is abnormal connection, abnormal channel between two of these parts. And also you may see the mecal diverticulum here and here. And also you can see on these parts the obstruction of this connection. It causes obliteration. And also you may see the cavity in this obliterated connection between ileum and narwhal. All these parts called Meckel's diverticulum, and it differentiates. So after passage in small intestine, the milk goes to large intestine, and the large intestine has three parts. First part is cecum with appendix, second part is colon, and third part is rectum. Colon has four parts: ascent colon, transverse colon, descent colon, sigmoid colon. So these parts of large intestine has difference between small intestine. You may see this enlargement, which called gaustra. Also you can see three ribbons, which called taenia, taenia libera, taenia mesocolica, and taenia aumentalis. And in details you may see libera or free taenia. And all these taenia are the longitudinal smooth muscle cells bundles, because these bundles are situated only in these taenias and nothing. They are absent in other parts of colon. And where these three taenias are crossing at the cupula of cecum, the basic part of appendix is arised here. For example, you may see cecum and taenias, libera taenia, and also you may see the connection between ileum and cecum. In details, you can see the parts of ileocecal valve, and it regulates the passage from ileum to cecum. Also, you can see the vermiform appendix, which contains the lymphoid tissue. On this picture, you may see the carcinoma of cecum. Here you can see the appendix in laparoscopic operation, and also you may see the inflammation of appendix. It's called appendicitis. You may see also the topography of appendix and variation in position in appendix. You may see typical position, medial position, pelvic position, ascending position, subhepatic position, here and here, retrocecal position, retroperitoneal position, and left-sided position. You can see on this picture, I repeat, the main positions of appendix in abdominal cavity. On this picture you may see the colon or large intestine. You can see the mesenterium of transverse colon. You may see Liberatenia here, Haustra, the enlargement of colon, and I told you that this is one of main difference between large intestine and small intestine. So also you can see the fatty appendices, which called appendices epiploids. These are also the difference between large and small intestine. So the function of large intestine is resorption of water also the function of microbe digestive, the enzymes of microbes works here, and also undigestive parts passes to rectum to evacuate from rectum to external environment. On this picture you may see some abnormalities of colon. For example, you may see Dolicha colon with the increase of sizes of sigma colon. You may see Dolicha colon here, and also you can see congenital gangliosis, megacolon sigmoidal. You may see that these sizes of this colon are very big, and this gangliosis develops with absence of innervation of the muscular part in wall of sigmoid colon. So the terminal part of large intestine is rectum. You can see two main parts: the ampulla to store these masses, and anal canal to evacuate undigestive masses to external environment. Also you can see the transverse folds, and on the anal canal you may see the longitudinal folds, which called columns, and you may see in detail that the mucous tunic passes to skin. This is the border between skin and mucous tunic, and also the medial part of wall of rectum is formed by smooth cells, muscular cells. These form internal sphincter, and external sphincter, which form with striated muscles. So you can see in details the parts of large intestine and rectum. On this picture you can see abnormalities of development. You may see atresia of rectum, the absence of lumen of rectum. And on these pictures you can see atresia of rectum, the absence of anal lumen, but you may see in details that rectum has stoma with urogenital organs. You may see that it has connection between rectum and bladder, rectum and urethra, rectum and womb and vagina. You may see that rectum on this picture opens via thin canal to urethra. On this picture it opens also in urethra and bladder. And on this picture you may see that rectum opens to vagina and bladder. But it has now the opening to external environment via usual place. So the lecture is finished. Thank you very much for your attention. See you again. Goodbye.